On this edition of Veterans Health Watch, we'll learn how to maintain a healthy lifestyle during the cold winter months. We'll also hear from an 83-year-old veteran who is staying fit and healthy through the VA's Jarrow Fit program. Please join us. Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin here at the Senior Exercise Rehabilitation Center at the Baltimore VA Annex. And as the winter months are quickly approaching, we know that sometimes we're tempted to hibernate and turn in the walking shoes for a spot on the sofa or with a cup of hot chocolate, but not this year. Joining us to talk about ways that we can stay fit during the winter months is Kevin Grotniski, the MOVE coordinator and a registered dietitian with the VA Maryland healthcare system. Kevin, thank you so much for joining us today.
Thanks for having me.
So Kevin, tell us about some of the challenges you hear from veterans when it comes to staying fit during the winter months and maintaining that healthy lifestyle that maybe they picked up during the summer.
You know, I think the biggest one is the cold weather. I mean, veterans during the summer months, it's much easier to get outside. Walking is one of the main exercises that veterans do throughout the nicer months. But in the winter, Baltimore, you know, pretty much from mid-November through March, we've got ice, snow, and then the bitter cold sometimes. And that can be a barrier for most of our veterans.
So how do you recommend that veterans stay fit during those colder months?
So you've got a few options. First of all, you can go outside, certainly. But if you're going to be exercising outside, you've got to think about making sure that you are dressing appropriately, making sure you've got warm shoes, hats, gloves, that you wear layers. So if you can get outside and it's safe to get outside for you, patients can exercise, walk, bike, run, hike, and other outdoor activities during the winter months. But for many veterans, you know, they're not going to exercise outside. So we've got indoor activities at that point. So you've got obviously a couple of main options there. You've got indoor in the home. So in the home, you've got the option of an at-home exercise routine. You've got video on demand, DVDs. The MOVE Weight Loss Program, we do give patients a free exercise DVD that they can exercise at home for. Some veterans have exercise equipment in the home, so that's an option. Second option would be away from the home. What are the options there? You've got mall walking, which is popular amongst our veterans. Many of the malls allow patients to come in early and walk during non-peak hours or during the regular hours as well. Patients can go to gyms, local community or senior centers. So those are a few options. We also have options for exercise here at the VA. We've got a program that we're going to talk about later called Jarrow Fit for our senior exercisers, which is a great option. And the MOVE Weight Loss Program at certain locations also has some exercise options for patients as well.
Tell us more about the MOVE Weight Loss Program.
So the MOVE program is a 3-phase program. It's actually a 16-week program. We have it at all sites, almost all sites at the VA Maryland healthcare system. And we have a women's MOVE program here at the Baltimore location and a regular MOVE program, which is for both men and women. And we have programs at Loch Raven, Glen Burnie, Perry Point, Cambridge, Pocomoke, Fort Howard, and here at Baltimore as well. And it's a 16-week weight loss program with follow-up and maintenance programs thereafter. And the program has segments and workshops on nutrition. So nutrition is crucial if you want to lose weight and get healthy. So you're looking at how to eat healthy, breakfast, lunch, dinner, snacks, eating out, special occasions, snacking, beverages, eating while traveling, during the holidays, during the football season. There's a physical activity component, education. What types of exercises to do, how much, how often. Patients get a pedometer to track their walking or running. They get an exercise video like I talked about, resistance band, and some sites have on-site exercise. And then there's the behavior component. Does anyone eat when they're bored, stressed, and how to eat during the holidays, how to stay motivated. So we offer regular weekly visits, 16 weeks for our patients for support, motivation, and check-in. Lastly, there's a telemove program, which is a home-based version of the MOVE program for patients who can't get on site during our regular hours here.
And I know the education component is a large component of the program. I've heard veterans just in passing discussing how much they've learned about the unhealthy foods that they were eating they didn't even know were unhealthy.
Absolutely.
So that's a great program. And tell us about who's eligible to participate in the MOVE program, and are they referred, or how are they referred to it?
Good question. So the general MOVE program, they simply just need to have an appointment made for the program, and they can call our call center for that information. They can call my number. I'm the MOVE coordinator for the state of Maryland. They can call me as well for information. Or they could check with their local healthcare team. Basically, you need to have a BMI, a body mass index of 25 or greater to be eligible for MOVE and have a desire to lose weight. It is a weight loss program. How do you know what your body mass index is? At your next healthcare visit, you can ask one of the nurses or physicians what your BMI is. It is in your medical record. If you want to go online and do a search for BMI calculator, you can put in your height and weight, and that'll give you a BMI. So generally 25 and above makes someone eligible for the MOVE program. For the telemove program, it is a consult-based program, whereas the regular live in-person 16-week program is not. So if you're interested in telemove, you want to get with your healthcare team, your primary care doctor, or other member of your healthcare team, and ask them to place a consult for the telemove program.
And going back to exercising, we talked about the winter month, and we talked about an older population.
Yes.
How do you recommend that veterans and the general pop just stay fit, or stay safe, I should say, when exercising?
You know, I think that the big thing is, first of all, if you're exercising in the cold, that can be an increased stressor when exercising. So, you know, I know if I'm doing, if I'm running in the cold weather, you know, it may be a little bit more difficult than if it's, you know, fall or spring or during the cooler times during the summer. So you really want to make sure you have appropriate footwear to keep your feet warm, warm socks, an appropriate winter hat so you don't lose a lot of heat, and you want to have the right gloves, and you want to wear layers as well, because if you're cold, you're not going to be comfortable and you're not going to keep it up. So if you're out there warm, you may repeat it and do it more often.
And we talked about some of the challenges to staying fit during the winter months. How do you recommend people overcome those challenges when we talk about maintaining a healthy eating style, a healthy diet?
So in the winter months, people often tend to put on weight. Why is that? You've got the holidays. So there's many holidays, you know, from Thanksgiving to the religious holidays to New Year's. Often people think of the entire season from Thanksgiving through New Year's as a holiday season, which it is to a degree, but you really want to think about those eating occasions as just one meal. If you go to Thanksgiving or another event, and if you have a little extra during that meal, it's not going to cause weight gain per se. But if it becomes multiple meals, multiple weeks, that's when the weight picks up as well. So you really want to think at that occasion, no big deal. Try to end it there. If you're bringing home weeks of cakes, pies, and cookies and munching on them, that's when you're going to gain weight.
That's something to keep in mind, because it's usually not just one occasion.
That's true. That's true. Also, the rest of your week, you want to be as healthy as possible, knowing, hey, you may have multiple occasions that week. So the other thing is, do you have a strategy for eating healthy during the occasion? You know, most of us are going to have a few indulgences at a holiday party, but you may think, hey, I'm going to have water instead of soda. You know, I'm going to have a half a plate of veggies or fruits with the meal instead of no veggies at the meal. Maybe even having a healthy snack before the event so you're not starving. Some people don't eat all day. They're starving at the event and they overeat. So think about eating as normal throughout the day so when you go to the event, you're not famished.
Well, Kevin, you've given us some great information.
My
I know
pleasure.
people want to learn more. So where can they go to get more information about the MOVE program and some of the nutrition tips you mentioned?
So you can go to the MOVE website. There's a national site, has all of our MOVE handouts, www.move.va.gov. That's a national MOVE website with success stories as well. You can also call our call center to make an appointment with the MOVE program. You can, at your next visit to the VA, you can make an appointment with MOVE on site. You can also call me, the MOVE coordinator, and I'm here Monday through Friday and be happy to answer any questions.
Thank you so much, Kevin. That was great information. We're going to take a short break, but when we return, we'll be here at the Senior Exercise Rehabilitation Center to learn more about how to stay fit during the winter months. So please stay tuned.
The VA Maryland healthcare system has 3 main campuses where we deliver medical care.
And also 6 outpatient clinics, which are conveniently located around central and eastern Maryland.
All these facilities provide a broad array of services: primary care, comprehensive mental health care services, audiology services, optometry services, podiatry services.
And at our main medical centers, we have a full array of medical services to offer all veterans.
Come visit us at any one of our locations. We look forward to serving you.
Welcome back to Veterans Health Watch. During our first segment, we talked about how you can maintain a healthy diet and fitness level during the winter months. And joining us to discuss overall health during the winter is Dr. Martin Garcia, the director of the Ambulatory and Emergency Care Clinical Center for the VA Maryland Healthcare System. Dr. Garcia, thank you for joining us.
It's great to be here.
Let's jump right in with the hot topic during the winter is the flu. So as a doctor, what do you recommend people do to protect themselves against the flu?
Well, we really do recommend the flu shot, annual flu shot. So for those people who get it every year, remember, you got to get it again this year. And the idea being is that we can offer you the best protection with the flu shot. And then don't forget the simple things: washing your hands, getting good sleep, staying away from people who are definitely sick. Those are important things. Be careful when you're sneezing and coughing. Try to cover your mouth and nose. Do all those basic things that our parents taught us, but also please try to come in and get your flu shot.
And at the VA Maryland Healthcare System, for veterans who are enrolled in the system, the free shots are
Yep, the flu shots. Yep, flu shots are available at all of our sites. No appointment necessary. We actually have a lobby flu clinic at the main medical center, as well as all of our clinical care sites offer flu shot.
Great. And for those veterans who have doctor's appointments, I know sometimes just the thought of getting out in the cold for one more thing can be daunting. What do you recommend our veterans do?
Wintertime, getting out. Well, we're very sensitive to that, especially with our older veterans. During the winter months, we actually do encourage our veterans, if the weather's bad, if things are tough, if they're not feeling well, we'd rather them stay home and stay safe. They can pick up the phone and let us know that they're having a problem getting there. We also offer a wonderful way for our veterans to have contact with their teams is a telephone appointment. So both doctors and nurses have telephone appointments that a veteran can request. They can stay in their pajamas. We can give them a call at home and try to take care of a lot of their needs that way. And many times that's a nice thing to do, especially when people are feeling a little more isolated and having a hard time getting out in the winter.
But definitely call if you can't make an appointment.
Yeah, we also obviously urge our veterans, give us a call if you're not going to be able to make it. We can always find another person to see and someone else to help. And so it's nice if we know that you're not going to be able to be there. And also just gives us a chance to know and to check in with you to make sure you're doing okay.
Great. And what about we know that the winter has shorter days, and that means it's dark more, and that can affect people's mental health status. What do you recommend, or how do you help people during that time of the year?
Yeah, I mean, I think a lot of the same things that we encourage all year round and that we're hearing about today too is I think exercise is very important. And obviously during the winter months, if one can get some exercise indoors, whether it's a gym or a fitness club, other great opportunities, especially coincides with the shopping season, is getting out in the malls and getting out and doing indoor exercises, and many of them actually have walking programs. So I think good physical exercise, good sleep. Sometimes we sleep a little more in the winter. Listen to your body, allow that, but also keep a routine. And I think another thing is staying connected. Staying connected to family, friends, keeping your routine, maybe pushing your social agenda a little bit more, so you're not inside all day, all week.
Okay. And for those veterans who maybe the winter months get them down anyway, and you have primary care services, how do you work with mental health? And if you could describe how your primary care services work and then how you work with mental health.
Yeah, absolutely. So primary care is one of the main things that we do at the VA Maryland Healthcare System. That's our welcome mat. That's our touch point for our veterans and their families. So primary care, we already are looking at not just the veteran and their physical health, but the veteran and their mental health. So a wonderful place to always connect with, especially for someone who may be feeling, as we say, a little blue, not sure why they're feeling a little different during the winter months. A really good place to start is with your primary care team. In addition, as you mentioned, we have integrated mental health services in our primary care sites, all our primary care sites. So sometimes if there's some further questions or further issues that need to be explored, we actually have the staff in place. And then once again, we have a vast array of specialty mental health services, both individual and group modalities that are available to all our veterans.
You mentioned a team, a patient care team. Tell us more about that team and how it benefits the patients and how they can access their team.
Okay, yeah. So each of our primary care teams, what we call a patient-aligned care team, it's a group of professionals aligned around the patient and their family. So there's a primary care provider who's a physician, a nurse practitioner, a physician assistant, a nurse care coordinator, a licensed practical nurse or a health tech, as well as a clerical associate to help with navigating our healthcare system. And that's your primary team. That's who you know, that's who we want you to know, that's who you get in touch with and can help you get the care you need, either deliver it directly or help you find what you need. In addition to those core teams have access to clinical pharmacy, social work, mental health professionals, as well as our clinics are staffed with services such as optometry, audiology, and physical therapy, occupational therapy. So we expand that team based on the needs of the veteran, but we really do like to make sure the veteran knows who that patient-aligned care team is for them.
And it's great for veterans to know that the VA Maryland healthcare system is more than just a hospital. Some people just think, okay, I'm not sick, I don't need to go to a hospital, but it offers a comprehensive program.
Absolutely,
services.
and I think most of us would agree we don't want to be in the hospital,
Right.
and so that's our job too in primary care and the VA Maryland healthcare system. We want to prevent hospitalizations, we want to prevent complications from chronic illness. We want to detect a sickness or an illness early on.
Right.
So that's a big part. So yeah, absolutely. Our system, we have primary care services throughout the state of Maryland in our catchment area. Clearly, we have links to the hospital system, but the majority of the work that we try to do is to keep our patients healthy, aware of what they can do to stay healthy, help them prevent illness, and if they do have a chronic disease or some other condition, we're there to help them manage that so they can stay out of the hospital.
And you mentioned that you're located throughout Maryland. Can you name a few of those locations?
Sure. We're all the way over to the eastern shore of Maryland, as far down as Pocomoke City, which is close to the Virginia border on the eastern shore, up through Cambridge, up at Perry Point, kind of north part of Maryland. Here in the city, we have Loch Raven, we have the Baltimore campus, we have the Fort Meade campus on the base with Fort Meade, we have Glen Burnie and Fort Howard. And those are our main primary care sites, and as well as many of those are connected to more specialty services.
Great, good for our veterans to know. And what about, how can veterans get in touch with you, or how can they learn more about the services that are offered to them?
Yeah. Well, so we have lots of ways. For veterans who are interested in getting a first-time appointment, we have our main Veterans VA Maryland Healthcare System number along with a scheduling center. It's a one-stop call where veterans can call in, speak to someone who can actually help match them with the closest location to their home so they can get a new primary care appointment. And for those patients and their family members that have already been seen by their primary care provider and team, they have those numbers accessible. Let me mention a couple other things too. Is we have something called secure messaging, and veterans can enroll in My Healthy Vet and then do a second layer of enrollment in that system, which basically allows for a secure email system. That email system allows them to privately contact their healthcare team, and that's actual contact with primary care team as well as to our specialty services. So secure messaging is also a great tool. And then, as I mentioned before earlier, I really like the idea of the telephone appointment. I think it's something that we do here that's different, and I think it's really adds a lot of convenience and access for patients without having to come all the way to the medical center. A lot what we do in primary care is listening and talking and teaching, and helping people understand what they can do to stay healthy. And so many times we can do that by just good contact over the phone.
Absolutely. It's great for veterans to know that they have so many options to access the care.
Yeah, and
So-
that's what we're shooting for.
Thank you for joining us today, Dr. Garcia. I wish you a happy, healthy winter.
Thank you so much.
We're going to take a short break, but when we return, we'll hear more about the Jarrow Fit program for our senior veterans to stay fit during the winter months. So please stay tuned.
It's important to get a new flu shot every year. It's very easy to do, and it can protect you or a loved one from getting sick. People who are at high risk for the flu are those who are over age 50 or those who have underlying heart or lung conditions.
The flu vaccine is offered free of charge. We do the vaccination in various clinics.
You don't need an appointment. You can walk in and get a flu shot when you show up. Thousands of people die from this, and it's preventable by a simple vaccine.
Welcome back to Veterans Health Watch. Joining us to talk about exercise programs for older veterans is Jamie Jafuni, the Jarrow Fit Program Manager and an exercise physiologist for the Geriatric Research Education Clinical Center at the Baltimore VA Annex. Jamie, thank you so much for joining us.
Thanks for having me.
So Jamie, tell us about the Jarrow Fit program and how can a veteran participate?
So Jarrow Fit is an exercise and health promotion program for veterans who are 65 and older. The goal of the program is to improve mobility and functional performance in our older vets. Ideally, we will keep them living on their own in their homes longer and living better longer. In order to participate, you have to be 65 and have a primary care provider at the VA, and you have to have all of your medical problems be stable. If your doctor thinks it's okay for you to exercise, then he or she will place a consult for Jarrow Fit, and then you'll be reviewed by the Jarrow Fit team.
Why is it so important that older veterans exercise?
So as you get older, people tend to become more inactive, and more inactive older adults tend to lose 30 to 40% of their strength and about 50% of their cardiovascular fitness. So this puts them at great risk to develop disabilities. Exercise is a proven way to prevent these problems, but not many older adults do it.
Jamie, how much should older veterans exercise, or the older population in general?
So older adults should do both cardiovascular exercise and muscle strengthening exercise. Cardiovascular exercise is things that gets your heart rate and your breathing up. They should do that for 30 minutes on 5 days out of the week, and it should be at a moderate intensity. So you should be able to hold a conversation with the person that they're exercising with, but it shouldn't be easy. And that would include things like walking or cycling or seated aerobics. And muscular strength exercise would be like lifting weights or resistance machines or resistance tubes. And that should be done 2 to 3 days out of the week at a weight that they can lift safely, but that is a little bit difficult when they get to the end of their number of repetitions. We recommend that they do 5 to 10 exercises and 2 sets of 10 reps. So they should do the exercise 10 times, take a break, and then do it 10 more times. And then also balance training and yoga are recommended to help reduce falls, which is another big problem.
So it's very similar to what we read about the general population when it comes to maintaining a productive fitness level.
Older adults should do everything that younger adults do. They just, if they're previously inactive, they should just start at a lower pace and progress slower.
How old is too old to start?
You are never too old to start exercising again. We've had plenty of vets join our program who are 90 years old or older. Anybody can make gains and have benefits by exercising.
And how is the VA helping to increase the number of older veterans exercising and participating in programs like Jarrow Fit?
In 1987, Dr. Miriam Mori at the Durham VA developed this program called Jarrow Fit. In 2013, the VA offered money to expand Jarrow Fit from Durham to other sites. The Baltimore GREC applied, and we were able to receive the money, and we started our program almost 2 years ago. So we're trying to make it part of routine clinical care for the older veteran.
And the GREC, just to clarify, is the Geriatric Research Education Clinical Center.
Yes.
Great, and you do great work for our veterans to help them stay fit and improve their health. Thanks, Jamie. I understand we have a veteran joining us today. He's a U.S. Navy veteran and a participant in the Jarrow Fit program, Mr. James Stokes. Mr. Stokes, thank you so much for joining us.
It is a pleasure, man.
Pleasure to meet you, too. Mr. Stokes, give me a little bit of background about your military history.
5.5 years on a destroyer. I don't know, everybody don't know what a destroyer is, but it's one of the Navy vessels, the many vessels that they have. I was in the fire room, which makes steam at that particular time, burning in the backfield.
So you're a pretty busy young man.
Oh, yes.
Yeah. How did you learn about the Jarrow Fit program? And
Well, I was
become a
recommended
participant?
through a member of the, not the urology clinic, but one of the other clinics, and they recommended me that I come, it would be beneficial to me. I says, okay, I didn't want to come the first day, but the second time, I says, I'm going to go to see what it's all about. And I'm glad that I have joined. It's the best thing ever happened to me.
But that was going to be my next question. How has this program improved your life since joining it?
Greatly. But the coordinators that they have here, lady, is outstanding. I mean, the best. I remember one time I couldn't use this arm. No, they made sure that I was able. No problems. Great.
Yeah.
And not only that, I don't have that laziness feeling anymore. It's a great feeling to get up and come down here, and I recommend it to everybody that I possibly can.
What kind of activities do you participate in when you come here? What's your day
whatever
like?
I possibly can, whatever I can. I have learned to do it slowly, not try to do it all fast, because it will hurt you. But the coordinators are so outstanding that they make sure that that doesn't happen.
And Jamie mentioned that you have to be 65 or over to join the group.
I didn't want to bring that up, but
Well,
I'm up in the 80s. But
I was going to ask. I thought you weren't even 65, but you said in the 80s.
I fooled you, though.
Yeah, you
didn't I? Well, that's wonderful. That's wonderful. But I don't feel that age.
Yeah.
That's the good part about the Gerofit program. It gets you in the mood that you look around, you see some people walking around like 46, 47 years old, walking with canes. Knock on wood, I haven't had to have a cane or anything of that sort due to the Jarrow program. That's the reason why every little program they have, every little exercise they have, I try to participate. And sooner or later, it'll work for me.
Yeah.
It'll work for me, and I'll have an easier way than hey.
Well, you look great. What would you tell those veterans who haven't gotten off the sofa yet, or maybe they just aren't sure?
Everyone that I see, I try to get them to participate, but some of them can't make the grade. This is one as I was just starting walking with a cane. They can't make the grade. For some of them, the hospital or doctors won't permit them because they're not in the shape they had started earlier. Possibility they could have been doing the same thing I'm doing. But some of them take my advice and try to join. Even people on the street, they tell me veterans, but I try to get the people off the street too, especially family members, neighbors, or whatever. Get into the program. Whatever you do, if you don't get that exercise, you can't. Exercise can do everything, make you do everything.
That's what we've been learning throughout the program, that exercise is the key to maintaining a good, healthy lifestyle, or coming back to a healthy lifestyle.
Yes.
Well, Mr. Stokes, thank you so much for sharing your experience. Thank you for your service, first of all, as a veteran, and thank you for sharing your experiences, and I wish you all the best.
I need the best.
We all do. Thank you. And thank you, Jamie. Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or you can visit us on our website at maryland.va.gov. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please visit our website, come into one of our medical centers to enroll. We look forward to serving you. Please join us next time.
Applying for the VA healthcare system is one of the best things you can do for your health and well-being.
A lot of veterans, for some reason, don't realize that they are eligible for VA healthcare benefits.
So we always encourage the veteran to call because each veteran is enrolled on a case-by-case basis.
Once I obtained the knowledge that I could enroll, I enrolled, and it's been a great decision ever since.
A veteran can learn more about eligibility for VA and health care at 1-800-463-6295, extension 7324.